Yes. Yeah.
Good afternoon.
Hi, welcome to our maiden voyage. This is the first of what I hope to be monthly conversations with our practice community and other guests. So what made me think of doing this actually was several things. One was a conversation I had with Dr. Patel, who's at work there in the ICU somewhere in Anne Arundel County, as well as many conversations that I've had with many of you and my colleagues here in the office, as well as Dr. Sanders. I don't know if she's joined us yet, but everybody raising concerns, issues, and so forth about COVID. And Dr. Patel actually talked about it. One of the things that we thought was a big obstacle really had a lot to do with trust or lack of trust with the medical community and our community at large. And so I thought, let's have a conversation and talk about COVID and whatever things come to mind. This really is meant to be a very safe place for people to talk about their concerns about COVID, their concerns about the effects that it's had on them, their families, and the community at large. So I'm going to start, and I hope that I do very little talking beyond what I've said now, but I'm going to start by asking Dr. Patel to introduce himself since I'm looking at him, and then we'll go on from there.
Hi, everyone. Thank you for inviting me to this. My name is McKnight Patel, and I'm the Director of Critical Care Medicine for Luminous Health, and our hospitals include Luminous Anne Arundel Medical Center, as well as Doctors Community Hospital in Prince George's County. So I've been working in both those environments during the COVID surge. Dr. McKnight and I go back a ways. He was our pediatrician for our first child, who is now 13. And so we've had two subsequent children that Dr. McKnight also takes care of. So I've gotten to know her through the years. And I was very excited to kind of be invited to a forum such as this, because I think this is warranted, and I think this is a very kind of important proactive step in building that and strengthening that patient-physician relationship, because it honestly has changed. The COVID pandemic and the climate in this country, whatever you want to call it, political or not, has all kind of come together in one, and it's altered the physician-patient relationship. It's one of the things that Dr. McKnight and I, it's sacred for us, and the prospect of doing whatever we can to ensure that relationship is strong and full of trust is something that's important to us. And this whole experience, I think, has, like I said, has put a strain on this, and misinformation, disinformation, mistrust, certain factions, and tribalism, which is occurring. Let it occur, but it should not kind of break our bond and our trust and faith, that we have in each other, and we want you guys to understand that we share the same interests, and the health of our patients, happiness of our patients. So, sorry, a little long-winded, but I think that's my introduction.
Okay. Dr. Sanders, are you there? I can't see everybody. Dr. Sanders
Yes,
is
I just joined.
okay. You want to introduce yourself, please?
Yes, I'm Dr. Leslie Sanders, and I'm a clinical psychologist. I work with children and families. I'm also certified in for brain health, and I also provide weight to children.
Okay. And you know, Dr. Calkin, who's there? Dr. Calkin, you want to introduce yourself?
I'm Dr. Calkins. I work at McKnight Pediatrics.
Why don't you introduce yourself, and then I'm going to figure out how to stop that.
Can't hear you, Dr. McKnight.
So I really want to give lots of time for our families, our parents, to ask any questions, to
You're back on mute.
probably my staff is muting me. That's great. This is the only opportunity they have to do that. So, but anyway, I don't want to waste time. We only have an hour, and I really want to hear from our families, your concerns, questions about COVID, about patient provider relationships, anything that comes from you. So have at it. And we're all learning from this, by the way. As I said, this is our maiden voyage, and hopefully each time we'll get a little better, a little better. Okay, I see Melanie Nix. I should not be driving this, by the way. I am the absolute worst.
Okay, I'm Melanie. I have two children who are patients in your practice. I have a 14-year-old ninth grade daughter and a 17-year-old 11th grade son. And just to kind of get your perspective, they are both, this semester is their first semester back in 5-day-a-week school, both of them. They are both fully vaccinated, both masking up in school. But as we are moving forward with sports, I do have some concerns and just wanted to kind of get your perspective. My son has played lacrosse, which I was, fairly okay with because it was outdoor. But now they're coming inside he's a wrestler, and my daughter is doing rock climbing. So just kind of wanted to get some thoughts on that and just. Again, I'm very COVID shy and probably on the extreme of nerves. So just kind of wanted to get some perspective on that.
Well, just briefly, I think we all want to, especially with our young people, try to get them back to being active and community oriented and back into all the sports and that sort of thing. So the wrestler, I think, is at a bit greater risk than the rock climber. Hopefully everyone who's wrestling with is also fully vaccinated.
They are.
Yeah, so the thing is, the vaccine isn't going to prevent you from getting COVID necessarily, but it will keep you from becoming deathly ill and in the hospital. So if that's his passion and something he really likes to do, I would let him do it in as safe a manner as can be done. And he's vaccinated. The other students are vaccinated. I'm not sure you can wrestle with a mask on, but perhaps. But I would say let them do it, and you're doing all you can. I guess the other thing we can all do is encourage everybody we bump into to get vaccinated, because that's really how we are going to move to a better place where it's more safe for everyone to move about doing the things we like to do.
Okay, and they are testing them once a week. And I did ask Dr. Calkins, I think when we were there a couple of weeks ago, about a mask, and did get communication back that he could wear a mask. So we are trying to put as many precautions in, but again, allowing him to pursue his passion. So thank you for your feedback.
You're welcome. I see Christina Dalton with a hand up. So I can't see everybody, but go ahead. I'm figuring.
Hi, good afternoon. I have a quick question. My daughter also visits your practice. She will be 4. I'm sorry, she'll be 5 in January. And I know that's the age of vaccination for children. But I guess the question I have is, recently in the news, there's been like confusion with dosage around, the younger children receiving the vaccination. So I'm just wondering, one, if your office will be giving it. I mean, I assume it would be. And then 2, is there some sort of safeguard or precaution to make sure that the proper dosage is being administered? And then also, do you recommend it for this age group, or do you think that it's something that, I guess, like kind of wait it out and see how the first batch goes, or like just what advice do you have in that regard?
I do recommend it, and yes, we have been giving it. I think we've given 290 doses so far for the young children without any callback complications. I think when you are careful with giving, that's how you avoid mistakes. And it's a lot of organization and a lot of paying attention, because it is easy to make mistakes. And hence our scheduling policy, so that we aren't flooded with patients and rushed and hurried and more prone to mistakes.
Thank you.
Mm-hmm. I'm sorry, Kyle, you are on here, I hope, and you know best how to work this thing. So I see some hands, but I can't see who they are. So
Dr. McKnight, it's Xenia, and he showed me what to do to bring in the next guest, but he stepped away for a quick second.
You do whatever you need to do to see whose hands are up so that they can speak up. Okay.
I have a question. My hand's raised.
Okay, whoever that is, have at it.
Okay, hi. My name is Milan Potato. My daughter is 5 as well, patient of yours. So my question is going to be really quick, because it kind of ties into what you were just talking about. So you just stated you've already given 290 vaccines, specifically of the new 5 to 11 age group. And then you also stated there have been no callbacks, meaning so far so good with those kids. No. My biggest concern is kind of just the side effects, which of course I know we can't really answer that. We do need more time to see that, but I'm just wondering, so far within, I guess, the week or 2 weeks, are you seeing good results? No child is having severe side effects or anything like that, or any kind of really concerns with children so young getting it?
Right, we haven't gotten any callbacks.
Okay, good.
And I feel very certain if a child had an issue, we would hear about it.
Okay.
And we haven't gotten any.
All right. So far so good. Okay. My child just turned 5, so because we moved quite a bit away from you, really sad that I had to do that. We'll probably have to wait until her pediatrician office gets it. But I still wanted to sign in. I really appreciate you having this. This is really great. Great time to ask questions. So I feel better about it now.
Wonderful. Unless someone else has a question, I wonder how many.
Hi.
Oh, hi.
This is Dre Healing. My son, Kyron, is one of your patients there. I'm piggybacking along with the current conversation going. So he's actually turning 5 next month. So when he gets his well checkups, we usually get all his shots and everything. So will that be something that we include in his checkup, the children's checkups now, once they turn of age, that we can schedule the vaccination at that same time? Or is that a separate appointment?
In all likelihood, it can happen at the same time with advance notice. So when you make that appointment, you need to say, we would also like for him to get his first COVID, because each vial has 10 doses. And once we mix it, we have 12 hours to use it. A week ago, we had 6 hours. Now it's 12 hours. But at any rate, so we have to, in order not to waste, we have to schedule in groups of 10. So we can have 10 a day, 20 a day, 30 a day, but not 25, because then we end up doing 5 a day. We don't want to do that. So we really have to have a clear count on how many people want to come on a given day. And sometimes we end up calling same day either to add on or to move to the next day so that we're not wasting.
Okay. So I can just go ahead and schedule it. And then if anything needs to change, you guys will call and make any appointment adjustments.
We will. So if you see a number that's ours or you get a text or whatever, we are calling to say hi, but it's an important reason too, so that because sometimes we end up shifting people around.
Okay. All right. Thank you.
Mm-hmm.
Dr. McKnight, I have a question. I'm Dominique. 2 of my girls are patients with your practice. One just turned 2 and one just turned 4. And I am very COVID conscious. All of us actually did end up getting COVID. And I'm homeschooling them because I am so COVID conscious. But ideally, when I thought about homeschooling, I thought about those enrichment activities with other homeschoolers in the area. But because they're not vaccinated and because they did get so ill when they had COVID, I'm just hesitant to expose them. But I'm also aware that they've been kind of just with me in the house for like almost 2 years. So that's kind of concerning for me. And I just wanted to know, do you have any type of advice for how to, they don't even play with any friends, how to get them some type of activity, but also keep them safe. And I'm also pregnant, so I'm also very nervous around that as well. I will be getting my booster soon, though.
If you don't mind, I'm going to at least initially punt this to Dr. Sanders, because I think what I hear in that question is a lot about concern about the developmental aspect of daughters not being amongst their peers. So, Dr. Sanders.
Hi there, thank you. Can you just restate the question to make sure I understand? Is it that you're concerned about them being home for so long and how they can reemerge or like ways to kind of get them social now while they're being
ways to kind of get them social now, and whether or not it's recommended because they cannot get the vaccine and they did have COVID, even though we don't really go anywhere. And, they were really ill. Like my 2-year-old, she just turned 2. Her fever got to like 107. And my 4-year-old, who just turned 4, she was having hallucinations and everything. So they got really ill. And myself and my partner also got COVID, even though we were vaccinated. So I'm just kind of like, am I doing the right? And I know it's no like right or wrong answer, but am I doing the right thing, keeping them in the house? But I don't know how long I can keep them away from playing with other children. And, having that type of activity. I'm not going to send them to school, but I would like to get them some type of activity.
Well, do you know anything about their friends or other families as far as like their activities? So is there anyone that you feel comfortable with them playing with other players?
Not really, but I guess because they got sick, and we weren't really doing anything besides going to they went to Children's to see a speech pathologist and got sick.
Did it well?
Went to Children's Hospital, and I think they got sick because they got sick 3 days later.
Oh, okay.
So, I don't know. Not really. There's no.
Okay. I do get a concern, and that is one huge thing that we're seeing as kids have reemerged and gone back to school. We have seen some difficulties with peer interactions and social interactions from a developmental perspective. So, I think that if you're able to, find another family or create a pod, and lots of families during the whole pandemic did find ways to kind of create a pod, and people and other families with similar habits as far as like not being terribly exposed, and to create some playmates and play dates in that way to keep it safe. I've seen several families who've done that and have been successful in it and avoided COVID.
One thought that I had, was maybe if you have one or two other families with young children, not old enough to be vaccinated, if everyone would be willing to get a COVID test, a rapid test, where you get the result back the same day before you plan an activity.
Okay.
You might feel better about it that way.
Okay. Thank you.
Uh-huh.
I have a question.
I have a question. I'm sorry.
With the first one, then we'll move to the second one.
This is Alicia. I can go second if the other person wants to go first.
My question's super quick. My son is a patient in your practice, Dr. McKnight. He's 9 years. He'll be 9 years old next month. His school is offering the vaccinations, and was looking at moving forward with them because they want it to move quickly, I guess. Just wanted to know, should we, wait and make the appointment with your office, or go with the vaccinations at school? I know a lot of schools are offering it on site. And then I guess it's not as short as I thought it was going to be. My other question is, he doesn't have any respiratory issues or any heart issues, but I do feel like I've heard and I've read a little bit about the impact for children that may have heart complications or respiratory issues, some impact from the vaccine. And I'm purely speaking out of ignorance, but just wanted you to comment on that.
I think you can get the vaccine wherever you are most comfortable. It's all the same vaccine. It's all coming from the same distributor, no matter where you get it. So whatever is easiest and most comfortable to you, because I think if you enter it feeling hesitant, it's going to make it more difficult for him. He'll sort of pick up those vibes and potentially not do as well. The second, yes, it's a rare occurrence to have some cardiac manifestations or from the vaccine. It happens more from the disease, though. So I would be more afraid of it happening if my child actually had COVID versus the vaccine. And we've had only one in the practice who was a teenager, and it wasn't from the vaccine, it was from COVID. And he did have a full recovery, I'm happy to say.
Okay, thank you. Thank you.
Hi. Okay, so this is Alicia. I have two questions. The first one is, my daughter is about 1 month shy of turning 5, so she'll be 5 in mid-January. Does she have to absolutely wait until she is exactly 5 years old to get the vaccine, or could she get it right now? And then the second question is, do you all have any kind of kid-friendly language that would describe any adverse reactions to the vaccine? Because one of my concerns as a parent is that, like, they might not know how to describe heart trouble, but they might maybe, like, is there other language that would resonate with kids this young so that they can alert parents if there's something wrong?
Great question. Thank you for asking that. One thing that brings to mind for me, your second question, on the first couple of days that we did the vaccines, we got the kids to just write a line or two about their experience.
Joe, get away.
Having those comments,
John, just set it up here, okay?
Whoever that is, mute, please. It was very helpful to some of the other children who were more afraid. And we've posted all of those on the website. So I think before you bring your child in, that would be a great thing to show them and let them go through. Now, in terms of side effects, what I will do is I will get together with my other providers and with Dr. Sanders and come up with some very kid-friendly language to use to give them to be able to tell you if they're having a problem. And so that'll be available to everybody on the website. Dr. Sanders didn't know she was going to get homework, but
thank you.
One question I have.
Oh, sorry.
Oh, that's okay. Just a quick question. And for anybody who has any reservations about the vaccine, I'm wondering if you would be willing to talk to us about.
Those were actually the two questions I have are related to that.
Oh, you didn't know I was a mind reader?
Didn't know that. Hi, Dr. McKnight. Thank you so much for hosting this. My daughter, Sophie, is about to turn 12, and we've been with you since she was born. So the two questions I have are, one may be something I've just made up in my head about the vaccine, which is I wonder if weight has anything to do with whether or not we should consider giving her the lower dosage, because she's on the smaller side. And so with her about to turn 12 and with the approval of the 5 to 11 vaccine, I've wondered, should we be considering giving her the lower dosage instead of the 12-year-old dosage?
My answer she's going to be 12 when?
She's going to be 12 in a week.
Oh, that's pretty soon. My answer is I would wait the week and give her the 12-year-old vaccine because it's really not based on size or weight, but it's based on age and the way the immune system works at given ages. Okay. I'd be interested in what any of the other providers have to say about that.
And I do have one other question specific to the vaccine too. I've heard a lot of or read a lot of anecdotal stories, I guess, about women's cycles being interrupted or, disturbed in some way after getting the vaccine. I don't think there's been research done yet. I saw NIH approved some grants to kind of study this, but because our daughter is on the cusp, she's at that age and that stage, I've been concerned about doing anything that might, speed it up or slow it down or, whatever. So I was just curious if there was any information that you had about how the vaccine affects girls and women and their cycles.
I don't. I will say two things. One is I'm always happy to research something, and anything I find out I would post on the website for everybody. And at the same time, based on the mechanism of action of the vaccine, I don't see a correlation there.
Okay. Interesting. Okay.
But, I'm not going to say that it's impossible, but I don't see a direct correlation there.
Hi, Dr. McKnight. This is Abdullah Wright. We have 3 children in your practice. One who's 5 has already had kind of one of the 2 doses. The other one who's 4, who we assume she'll get vaccinated when she's 5. But the another one who's just 18 months. And so we were wondering, as 2 of the 3 children will be vaccinated by the summer, how much does kind of the mother being vaccinated while breastfeeding, potentially having a booster shot while breastfeeding, impact the immunity of our youngest one?
Well, there have been studies, albeit them small, but that data is really very positive and showing that the babies are receiving immunity. One, if mom had the vaccine during the pregnancy, but also for moms who are breastfeeding. I think most of the studies are done on younger children. So is it still true for an 18-month-old or a 2-month-old? I have to assume so, but I don't think that the actual data is there to say that. But my assumption would be yes, based on the data from the younger children, infants. We don't know how long that immunity lasts.
Okay, and oh, that's an interesting point. Also, is there any information on children under 5 and when that vaccine, if it's, whether that's a year out, 2 years out, or anything like that?
It's hard to say. I mean, there's definitely no information right now in terms of when it will be available. How the FDA is processing that, I don't really know.
Okay, thank you.
You're welcome. Thank you. Is there anybody in the audience who has concerns about the vaccine just in terms of trust issues?
That will be me, Dr. McKnight. Hi.
I did before as well.
Okay.
This is Mabel Hernandez. I have 2 kids in the practice. We joined recently during pandemic, so I haven't had the pleasure to meeting you. I have twins, 5 years old. They just turned 5 a week ago. So I myself have even the booster, and I jump at the first opportunity, but I'm so afraid with them. I'm not convinced. I want to ask you about experiences in other countries with this age population. Do you have any studies or anything in that sort to comment?
I don't have any of that information. I think we'll get more information actually from the US because I think we'll have larger numbers of the young age before other countries do.
I can also speak to the fears that I have to address your question. I guess just in general, with it just being something new. I mean, it's just like when the adults had to take it, for myself as well. I mean, it is new. I, do want to trust the science and what have you, but it is something new. So we can't really answer questions like, well, what's going to happen in 10 years or 20 years or what have you. We don't have those answers. So, it's a huge risk. I mean, it is, I guess, a calculated and kind of well-managed risk because we are in a modern era. We do have, modern science that went behind this. This wasn't something that just, was concocted haphazard. But at the end of the day, it is still a risk. It, is new. So I don't know how my body is going to handle this. I have to just wait and see and trust that I made the best decision. Now, I'm willing to do that for myself. To ask me to do that for my baby is a whole nother matter. So I'm definitely in line with the mom that was just talking that, this is really quite concerning. I'm willing to do it with me, but I'm not going to lie. I think I'm going to hold off a little bit, this just became available, I think a couple weeks ago, ending of October, what have you. So I do think I'm going to wait. And once I feel more comfortable with the data, how many kids have been vaccinated, how are they doing? That's why that was my main question that I wanted to get addressed here. Once I feel more comfortable with, seeing more kids get it and they're doing okay, more time has passed, then I think we might consider it for our child. But as of right away, she certainly wasn't about to be first in line. That's for sure.
Okay. Yeah, I think that the, in quotes, newness is likely a concern of many people. I will say that the messenger RNA technology for vaccines really isn't new. And I bring it up because the issues of trust, in my opinion, the healthcare system sometimes brings on itself. And what I mean by that is not full disclosure and not really explaining things to people in an open way, and ways in which people have easy, ready access to, because sometimes that gets interpreted as you're trying to hide something. And that's never a good way, in my opinion, to engender trust. And so I think that, and that's part of what this is all about, I think that the more information people have, and I think the more people feel a willingness to be able to ask whatever question or say whatever your concerns are, and not feel like, you know, someone's looking at you like you have two heads or something, then we're all going to be a lot better if we have that experience as we talk about these things that are, of course, incredibly concerning to all of us. I don't necessarily agree with all of my colleagues all the time, and at the same time, on any subject matter, at the same time, I don't think that any of us went into medicine to deceive people or to hurt people. I just don't believe that. And at the same time, I will say that many practitioners don't have good information either, and that's an issue. But no, I hear you and I get it. And again, we are going to have a safe society if we don't have safe communities. And so I look at my practice and everybody who's a part of my practice as my community, and trying to create, again, a safe space for us to be able to talk about these things. And when I don't know, I'm the first to say, I don't know, but I'll find out if the answers are there. So, and I'm also not one to recommend something or participate in giving something if I don't think it's a safe thing to do. I, by the way, was not the first of my colleagues to get a COVID vaccine, by far. I will say that my grandchildren have gotten their COVID vaccines, but I had nothing to do with that decision. That was up to their parents. In fact, they didn't even tell me about it. I saw a Band-Aid on my granddaughter, but that's okay. I did not want to be part of their decision unless they directly asked me.
I have a question. My name is Michi Tanzawa. My daughter Chloe is a patient with you all, and she is almost 3 months old. And I understand on Monday, Mayor Bowser is going to be dropping the mask mandate. And so, you know, when I've taken her grocery shopping, I haven't felt a ton of concern or overwhelming concern bringing her into an indoor environment because everybody is masked. Now that the mask mandate will be dropping, I have an incredible amount of anxiety bringing her into an indoor enclosed environment where people will not be wearing masks. Do you have any recommendations or advice for me on this? Because obviously she's quite a ways out from being able to be vaccinated, given her age.
Yes. Remind me of her age, please.
She will be 3 months at the end of this month. So she's 2.5 months.
God.
And I am vaccinated, fully vaccinated. I'm getting my booster shot next week, and she is breastfed. So hopefully some of that immunity will transfer to her. But, you know, with the breakthrough cases that I've heard, including, you know, friends of ours, of mine, who've actually been hospitalized from breakthrough cases, I just have a little bit of nervousness bringing her into an indoor environment without wrapping her in bubble wrap.
Yeah, so at that age, I just wouldn't. I would do everything I could to not take her into an indoor public place. I really wouldn't.
Okay, I really appreciate that. Thank you.
And if, by the way, and in particular, any of you who are involved in the political world or have political contacts or whatever, I think we need to put more pressure on the mayor, on the city to reverse that, especially, you know, the holidays are coming up and people will be gathering in larger numbers. There will be restaurants and, you know, all sorts of affairs. And I just fear that the numbers will go up again, and that doesn't help anybody.
But Dr. McKnight, this is Leslie. It was interesting that in Montgomery County, they've just reissued the mask mandate indoors because of substantial transmission. So it's interesting, we're right here at the same region, and the left hand has no idea what the right hand's doing. And so, and we crisscross,
Yeah.
and how is that, and I don't even know why they removed the mask mandate anyway, but not at this point in time. But nonetheless, it's interesting. I didn't know that this was what was happening in DC, but Montgomery County, as of Saturday, I don't know what the difference is between yesterday and today or tomorrow to reinstitute the indoor mask mandate, but that's what's happening in Montgomery County. So it's just interesting to see the differences and just, how do you contain it when people are going to be crisscrossing between, from one county or one state into DC?
Yeah, I don't know. And I don't know in the end who makes that final decision and who the people are who are consulted in that process. I really don't know.
Does anybody know if the DC mandate is applicable to schools? Because I haven't seen whether it's applicable to school buildings, but I'm very curious.
It's not. You have to wear masks in schools
Okay.
and in public transportation, and any private businesses that are requiring it.
Okay.
Thank you.
Yeah, that's helpful to know.
Dr. McKnight, I have a question. Can you hear me?
I can. I don't know who you are, but I can hear you.
My Portia Bomaduro, and my husband and I have a 2.5-year-old in the practice. And I noticed there was a question in the chat about travel and quarantine guidelines with kids. And I have that question as well. And I'm wondering, both my husband and I are fully vaccinated, have our booster, have our flu shot. We have all of the things. Obviously, our 2.5-year-old does not have the COVID vaccine because he's not eligible. And so I'm wondering, what would you recommend if my husband and or I have to travel? Should we quarantine when we come back before we have direct contact with our baby? I mean, we've been on the very, very conservative side of this, playing it very safe, not trying to expose him if we get a breakthrough case. And I just wanted to get your thoughts on that.
Yeah, that's tough because it's not all a medical issue. And I'll share my thoughts, and then I'm going to pull Dr. Sanders in again. And I think part of it depends on how long you're away, where you are. We can sort of keep up with the states that have higher numbers, and also how did you travel? Were you in your car and you drove somewhere, or were you on public transportation? Because, obviously.
I'm specifically asking about airplane travel.
Okay.
Just so
you're
just so you know.
spending time in an airport with lots of people. And in the airports, you don't have to wear a mask. I do believe that on planes, you still have to wear a mask.
I think the airport it's required.
Many airports, no, but maybe it varies from one airport to the other. I don't know. But I would try to be tested the day that you return, and in particular, if you can get a rapid PCR. And then at home, in particular, if you were in a high-risk state and you were around lots of people who were not wearing masks, I would continue to wear a mask at home, and 3 to 5 days later, be tested again.
Got it. That's very helpful.
Yeah, I worry about, in particular, young children, and especially if both parents are away. But either way, and depending on how long you've been away, it's important to reconnect with that child when you come back. But I'm going to ask Dr. Sanders to talk about that.
Which portion about reconnecting?
Yeah, well, just the time away from the parent, reconnecting, that kind of thing. Yeah.
How long is the time away?
So it's unclear. I might have to travel for work early in 2022, which I'm very nervous about because it's overseas. It's in Europe right after the holidays. It might be for about a week.
Okay. And how young are the kiddos?
2.5, just one.
Okay. Okay. So one thing that's important definitely is to maintain the contact. I guess if you guys are able to do FaceTime as much as you can. While I know there's going to be a time difference and so forth, but if that's going to be possible, would that be possible? Would we be able to have contact at all, or is it like no contact while you're on travel?
It depends. I'm likely going to be in meetings all day, and so the time difference will be the factor there.
Okay. So there's some things that you can do to concretize the time, because again, at this age, the sense of time is so, they don't have the sense of time. So like an hour could be a lifetime from someone at this age. So like if you can create a calendar of it, once you know when you're going to be away, and so that your little one can like cross up the days to kind of count down when you're going to be back, and maybe you can leave something of yours that your little one can hang on to, and to let your little one know that you will be returning. So that's called a transitional object, to kind of like to just hang on that mommy will be coming back, especially if you're not able to have any kind of contact during the week that you're gone. Or maybe you can leave things for whoever's going to be home with your little one to give to the child each day, to kind of have some continuity of your presence. That might be helpful as well.
Thank you. That's really helpful. Dr. McKnight, I'm sorry for monopolizing the conversation. I just have one follow-up on the getting tested when you come home. Can you speak a little more about the 3 to 5 day window? Is there any magic in whether you should do it on the 3-day side or the 5-day side?
Well, 5 days, one would, if you're 5 days negative, then you can feel pretty certain you didn't develop COVID while you were away. The peak testing time is 3 to 5 days. So, for me, 3 days, I would wonder, okay, well, it's still a couple of days that I could potentially convert to be positive. In your situation, I think, and especially if I put my mom hat on, I'd be so anxious. Okay, let me do this at 3 days. I might go ahead and do it again at 5, but I would want to feel safe having close contact with my baby. So right. Each hour would make a huge difference to me.
Okay, thank you. That's really helpful.
Mm-hmm.
I have a quick question. My name is Christabel. Oh, sorry, go ahead.
I just have a quick question about, Dr. Mc, what are your thoughts about the at-home COVID test by Abbott?
They're rapid antigen tests, and they're supposed to be fairly good. I have to say I've not really spent much time investigating them. Actually, let me change that. I have spent 0 time investigating them. Abbott is a reputable company, but again, and in particular, returning from Europe, where the numbers are really going up, and depending on where in Europe you are, I'd want a PCR to know for sure that I cannot fathom as a parent knowing that I brought COVID to my baby and they got super sick. That would be hard. So I would, again, let me just do the best test and know where I am. And that's a PCR.
Thank you so much. I had a quick question. My name is Christabel. I have a 2.5-year-old. And I was just wondering what you are seeing in terms of trends of infections or hospitalizations in children around this area. We're beginning to see kind of a bump in places like Michigan, huge spikes, of course. And then there's something going on in Europe that we don't know. Is this a different variant? Is this Delta that's now getting there? What would you recommend where would you say we are in terms of, is something coming to this area that we need to kind of hunker down once again? For instance, would you consider like not doing indoor dining? I'm also pregnant as well. I'm 5.5 months pregnant. So, I have my booster. My husband's vaccinated, but our 2.5-year-old is not vaccinated. How should we kind of see the next couple of weeks? Is something coming down the pike and kind of we go back to March 2020 and hunker down, or
the vaccination rates around here are high enough that you think, well, within reason, you can, do a few things, meet up with friends who are also vaccinated, or do indoor dining? What would you recommend?
I think that the numbers are, well, I don't think I know, the numbers are going up again, not like this time a year ago, but they are. And I think what we can all do, most importantly, is to encourage, beg, plead everybody we know to be vaccinated. That's, again, it's not a panacea. It's not going to make COVID go away. But what we do know is that in areas where vaccination rates are low, the hospitals are full of people, the ICUs are full of people with COVID. And I think right now, at best, if we can keep people from getting really, really sick, that will be a major achievement. And everybody, I imagine, or most people, will feel a lot better. The herd immunity is not, for whatever reasons, it's just not part of COVID. Herd immunity is not working. So we need individuals, all those who are eligible, to get vaccinated. And I think we all bear some responsibility, in particular in the medical community. We need to hear people and understand. People have fears for a whole host of reasons, and it's your fear. And so for someone to say it's founded or unfounded isn't fair. It's your fear regardless. And I think the best approach is to try to help walk someone through that fear, to hear them, and to let them know that they're heard and try to support them. And I think that's the best thing we can do to try to help allay people's fears and concerns. For me, the fear of being a patient in the hospital, and God forbid in the ICU, is enough to make me do most anything. But that's me. Maybe I'm a chicken. I'm just not up for that. And in terms of the eating out, I think in particular now, I'm still one to eat outside. I'm not one to go to a restaurant. And many of the restaurants are requiring that people show their vaccine cards. I think we all know that people have counterfeit cards, and so that doesn't really necessarily mean anything. Maybe it's real, maybe it's not, I don't know. I think, here's something that I think, it just hit me. This is a wonderful opportunity to have small gatherings and go back to the old days where we didn't go out to restaurants, but we invited another family over for dinner. And if you don't want to cook, you can still do takeout. Even some of the Michelin star restaurants do delivery in the city. So you can have a great meal with one other family or whatever, and not risk, putting yourself out there for COVID. I hope I answered all your questions. I may have forgotten something. I can't remember.
I mean, the other comment I had was whether we have a sense of what's going on, sort of beginning to peak out in Michigan, and whether trends are, is this something, the way COVID has worked in the last couple of years has felt, if there's a fire somewhere, better get ready because it's coming into something. So that's what I was just wondering, like, are we beginning to see an uptick here as well, something going on that, we need to kind of keep an eye on?
We are seeing a bit of an uptick, not like a year ago. In this area, our vaccination rates are pretty high, and so that's good. We need them to be higher, but yes, and what's coming down the pike, I really don't know. There are lots of predictions.
Dr. McKnight, can you hear me?
Yes.
Hi, thank you so much for holding this call. You're really good at unpacking a lot of these issues, and I'm really grateful to listen to all of this and to learn a lot. I wanted to ask a question about breastfeeding. My daughter's 1, and in the non-COVID world, certainly would be interested in starting to wean now. We're exclusive pumping, and you've made some reference to some of the studies out there. I've tried to read them myself, and it's so confusing. I just wanted to know, like, just based on the patchwork of information that we have about the benefits of antibodies, how many antibodies you need to pass in order for it to be helpful for a baby. How would you stick with it and keep pumping even if it's just a small amount, or do you think I'm boosted? Do you think that the benefits sort of maximized by now, and that we should just focus on keeping her safe and out of indoor communal areas and take other precautions to try to protect her?
Yeah. I can't really think of any situation right off the cuff where I think that stressing mom out is a good idea.
Thank you, ma'am.
I don't think anybody benefits from that. So, and you've breastfed for a year. That's terrific. If you're stressed, then you're going to destroy your immune system, which will impact negatively the milk that you're producing. Not only that, your child is going to be exposed to your stress on a daily level. And we do know that that has lifelong impact, not only on her, but on her never even thought about yet children. So those are certainties. What we don't know is if you nurse for another month, another 6 months, another year, we don't really know how that will impact her immune system and whether or not it will really protect her from severe disease against COVID. I would say in terms of protecting her against getting COVID, period, no, because it doesn't protect even the people who are getting it directly. So I can't imagine it's going to protect her getting whatever antibodies she gets indirectly. And so I would go with the known, quite frankly, and then do the other things that we know will help protect her. So the things, stress is probably the #1 insult to your immune system. I think we ought to think about that in terms of why we have so many people who've succumbed to COVID. We all need to take a look in the mirror and say, how's my stress? What do I need to do differently? Because being stressed out is not that'll kill you sooner than anything else, I guarantee you. And it has such a negative impact on your immune system. And babies get stressed, old people get stressed, everybody in between. So we need to really, really, really pay attention to that.
Great, thank you so much.
You're welcome.
Dr. McKnight, this is Kyle. One question from the chat I thought might be interesting to answer. There, one of our parents asked if you could speak to whether or not there are any benefits to spreading out the doses 6 to 8 weeks versus 3 weeks.
Yeah, I don't know the answer to that. I've been thinking about it a little bit as I have time to have some other thoughts other than what I'm doing in the moment. And I don't know if it's the same parent who sent me a message through the portal and asked and then followed up with some literature that I asked for, but I haven't had a chance to read it. So full disclosure with that. But what I did think about is the hepatitis B vaccine. Years ago, there was a study that came out that, typically we give the Hep B vaccine at birth, at 1 month, and then at 6 months. There was a study that came out, I don't know, it was probably 15 years ago, where they looked at delaying that last dose until 9 months. And it was determined that the immunity was more long lasting. So for a while in my practice, I gave it to everybody at 9 months until I got so much pushback from daycare, it was driving me crazy because the kids didn't have it at 6 months. So, but the messenger RNA vaccine doesn't work the exact same way, although the Johnson & Johnson vaccine is closer to the mechanisms of the hepatitis B vaccine. So I don't know, when you look at those studies, and I think there were studies done in Canada. I'm saying studies, again, I haven't looked at what was sent to me, so I can't really comment on that. But the information that has come my way has come out of Canada, and I don't know if it's based on messenger RNA vaccine, the Johnson & Johnson, or whatever. So.
All right. And then one other question that I saw from the chat. If a child gets COVID, what do you recommend we do to treat them and try to prevent severe illness?
Good question. Definitely they have to quarantine, and that's a time that I would really try to focus on their immune system, doing all you can to keep the immune system going. And how you do that, well, I almost want to say I'll post on the website, and a lot of it's kind of controversial, but I don't think anybody would disagree that being sure, and this is a good opportunity to talk about vitamin D because we push it a lot. I'm not sure that everybody knows why you push it, but it's a huge anti-inflammatory agent. It's one of the cheapest things you can buy that's really good for you, and you take it once a day, and it's an important cofactor in many of the steps of your immune system. So definitely, I don't think that's controversial. Everybody, I think, would agree. You can, a lot of people give zinc, a lot of people give elderberry. I would say you have to, these things are not regulated. So you really need to know what you're giving, what company made this, and is it really what it is according to the label? And you have to be careful with zinc because if you take too much zinc, you can bottom out your copper and get into trouble that way. So I always caution people, be careful if you don't know what you're doing. Things like elderberry, a lot of the elderberry syrups are a bunch of junk, and elderberry can be toxic depending on which part of the plant the serum was, the syrup was extracted from. So you really, really, really need to know what you're doing. Otherwise, you could end up hurting yourself or hurting your child. A good probiotic is always a good thing. It really does help to regulate the microorganisms in your gut, which are an important part of your overall immune system. And eating a good anti-inflammatory diet. All chronic disease, and Dr. Patel, if he's still there, could even talk on this, I think. We used to think people who died from overwhelming sepsis died from the infection. No, most of the time that's not true. It's the immune system going crazy for all intents and purposes. That's a medical term. And all the inflammation, and definitely that has been shown to be true in COVID. So we want balance because your immune system can either be overactive or underactive. It's important for it to be in balance. And so the best thing is for everybody to try to be healthy all along. And that way, whatever comes your way, you're going to have the best the best outcome that you can.
All right. So it's 1:06 right now. And so I know we had set this to go to 1 o'clock. Dr. McKnight, I'm not sure if you still want to continue, but we do have patients coming into our office, everybody. And so We do thank you for all your time and attendance. If you have questions still that you would like to answer, I do have them in the chat. So we'll try to get those to Dr. McKnight so she can review them and we can send responses back to you guys. Please send an email to us at the email address, lunchtimechats@mcknightpediatrics.com, so that we can get that to Dr. McKnight for review, and the providers can get those answers. And we are going to try to post this video onto our website for everybody to go back and review after we are done here. So again, thank you so very much. We appreciate your time and attendance, and we look forward for the next event. We've got some ideas. Please continue to send any ideas that you guys have that you want to discuss to us, so that we can put those into our fishbowl.
Thank you.
Thank you.
You guys have a great evening.
Thanks for having. Great.
Thank
Thank
you.
you.
Thank you so much.
Thank you all.